Hello, everyone, and welcome to today's Provider Education Network webinar. I'm Rihanna Pierce, the Heart Disease Manager at Wellhead, Louisiana. Thank you so much for joining us today. Today's webinar will focus on engaging with community health workers and how they are supporting Louisiana's COVID-19 response efforts. Before we get started with our presentation, I'm happy to introduce today's webinar speakers. Our first speaker is Colleen Arsenault. Colleen is the Population Health Manager at the Office of Public Health. In this role, she provides leadership to community health workers programming that seeks to improve the quality of life for Louisiana residents by helping to address individuals' health-related social needs and the factors that drive them. Our next speaker is Donna Davis. Donna is a community health worker supervisor at the Louisiana Department of Health. In this role as a community health worker, she is front and center within her community and works to increase the community's knowledge of health through outreach and advocacy. Thank you both for presenting today. I will now hand it over to our speakers.
Hello, everyone. Good afternoon. My name is Donna Davis. Thank you, Rihanna, for that lovely introduction. We have 3 learning objectives that we will mainly focus on today. We will be describing common roles for community health workers in clinical and non-clinical settings. We will be describing methods Louisiana partners are using to increase the use and support for the Louisiana community health workers workforce. And finally, we will list 3 ways community health workers responded to the COVID-19 pandemic in Louisiana. Next, I would like to state what a community health worker is. Community health workers are frontline public health workers who are trusted members and has an unusually close understanding of the community served. In this trusting relationship, CHWs enable service between a liaison link between health, social services, and communicate to facilitate access to services and improve the quality and cultural competence of service delivery. The CHW also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. Next, we will focus on CHW skills and roles. CHW has core consensus skills, some being communication, interpersonal and relationship building, service coordination and navigation, capacity building, advocacy, education and facilitation, individual and community assessment, outreach, professional skills and conduct, evaluation and research, and knowledge base. Some core consensus roles of CHWs are cultural mediation among individuals, communities, health and social service systems, providing culturally appropriate health education and information, care coordination, case management, and system navigation, providing coaching and social support, advocating for individuals and communities, building individual and community capacity, providing direct service, implementing individual and community assessments, conducting outreach, and participating in evaluation and research. CHWs wear many hats. Some you may be familiar with, some not so much. We can be a myriad of things, such as patient navigator, promotos de salud, peer counselors, parent liaisons, outreach workers, health advocacies, community health educator, peer advocate, family planning counselor, family support worker, and community health representative, to name a few. CHWs address many diverse issues. from chronic disease, which we may address asthma, diabetes, cancer, cardiovascular disease, infectious diseases such as HIV, AIDS, STIs, hepatitis C, TB. We also tackle early childhood intervention, lead poisoning prevention, parenting education and support. We look at things such as violence under domestic, sexual, youth, as well as suicide, environmental justice, emergency preparedness, nutrition services, tobacco control, and access to social and health services, to name a few. Next, I will look at CHWs in a non-clinical setting. CHWs work in various settings, such as hospitals, community health centers, managed care organizations, state and local health departments, community-based organizations, schools, and public housing authorities. Now I would like to look at some common roles for CHWs in a non-clinical setting. Cultural mediation between communities can lead to intimate knowledge of the communities they work, permit CHWs to serve as cultural ambassadors for their clients. Informal counseling and social support provides client-centered counseling to support clients to live healthier and better lives. Many help clients to set health-related goals and may use techniques such as motivational interviewing to support clients in reducing health-related risk behaviors. Some other roles include advocating for individual and community needs. Advocate within the community whenever possible to ensure clients have access to basic resources to live healthy lives. Also, building individual and community support. Work with groups and community networks, building the capacity of individuals to speak out and take action in their own lives and communities. Now I will withdraw and allow for Ms. Arsenault to continue the presentation.
Thank you, Donna. Good morning, everyone. Now I will continue on and explain the various roles and how CHWs can work in clinical settings. Sorry. Okay. When we think about healthcare's goals for optimizing health system performance, IHI, or the Institute for Healthcare Improvement's triple aim framework, is often cited. Community health workers can play a critical role in all three of the triple aims dimensions. So if we start in the bottom right-hand corner and think about reduced costs, CHWs can help healthcare systems save costs through fewer emergency department visits and lower hospitalization and readmission rates for complex patients. They can also help with improving health. CHWs help patients engage more fully in their care and adhere to their care plans. They help patients control chronic conditions such as lowering blood sugar and blood pressure levels. CHWs can also help improve the quality of care and the patient experience. So they can help improve health and healthcare utilization, which is often reflected in performance measures and standards promoted by NCQA and HEDIS and other quality measures. They can help improve retention in care through outreach to reduce no-shows and assistance with insurance enrollment and retention. CHWs can also help improve patient satisfaction through better understanding and help with addressing their social needs. And while reducing health disparities is not part of the triple aim, it has been recognized as a key part to improving healthcare quality across the country and across the world. And so one thing that CHWs really can do as well is help strengthen communication with underserved patient populations. And they often help to diversify the healthcare workforce. So some roles for CHWs in clinical settings. The Community Preventive Health Services Task Force recommends that CHWs can help in a variety of ways. They can help with screenings for breast, cervical, and colorectal cancers. They can help as part of the team-based care model for cardiovascular disease prevention, diabetes prevention and management, They often serve a very good role in providing health education to patients. Because they often speak a similar language as the patients, not only if it's English as a second language, but also just coming from the same community, CHWs can often help with patients' health literacy. They often conduct home visits or help with care coordination in a healthcare setting. They can help enroll patients in Medicaid or other insurance programs. And finally, as mentioned before, CHWs really play a strong role in health education. Financing for community health workers. This remains a big question in the state. And it's a big challenge that we're all facing. You know, at times, and what we've seen right now is that health systems and providers are using funds from their core operating budgets to fund CHWs. They'll often conduct a pilot project and see what their return on investment is and decide to move forward with it. They often receive grant funding to support the community health workers. And finally, there's always Medicaid managed care financing. Other states have seen state plan amendments or Medicaid waivers towards Medicaid reimbursement. And we do know that right now, our Medicaid program is seriously considering supporting CHWs and determining the best way to provide sustainable financing for CHWs. And there's a lot of talk about CHWs right now going on across the nation. And we saw very recently the American Rescue Plan Act of 2021 allocated funding for community health workers and public health departments. Community health workers often serve as a bridge between public health, healthcare, and social services. So that's a role that I'll explain a little more about in a minute, where our Office of Public Health and CHWs can start bridging that gap. So there are a lot of efforts going on across the state to support CHWs. A few years ago, the Louisiana CHW Workforce Committee was formed out of legislation. And in a couple of slides, I'll go over some of the recommendations of this workforce committee after they conducted a study statewide. We also have the Louisiana Community Health Outreach Network, or LaShawn, and I believe I saw that the director of that network, Ms. Catherine Haywood, had joined this webinar. So Catherine, thank you for joining. But LaShawn is a professional association for CHWs in Louisiana. They provide technical assistance, they provide training, and they also just serve as they provide opportunities for CHWs to network and to learn from each other. Many of the Medicaid managed care organizations employ CHWs, so you might encounter those individuals in the communities. And then where Donna and I come in is the public health programming, and as well as Well Ahead. The Office of Public Health has recently hired 18 community health workers, and we'll go into more details, but they're working on two main programs. It's our Community HealthWays program that I'll describe, and then Donna will provide more details about how they have been integral in responding to the COVID-19 pandemic. We know that the Louisiana Breast and Cervical Health Program, they employ community health workers who serve as patient navigators to get women to the screening services that they need, as well as the Office of Public Health's HIV and STD program is part of a nationwide effort called Ending the HIV Epidemic, and they have community health workers in some of the larger urban areas that have high HIV and AIDS rates. So here, I'm not going to go through every single detail here, but as I mentioned, the Louisiana Community Health Worker Workforce Study Committee was started a few years ago through legislation at the state level. And so the committee, along with other stakeholders, the first recommendation that came out of them is that this group needed to continue meeting. The legislation did sunset, it was not renewed, but the group has continued to meet on a monthly basis. One very important thing that this work group or committee wants to ensure is that community health workers are always present, and that at least half of those individuals that are attending meetings are community health workers. And this kind of goes by the basic tenet of working with CHWs, is being nothing for us without us. So if I were to attend a meeting as a community health worker ally, as a program manager, I always ensure that there are CHWs that represent our program as well there. And so this coalition is continuing to advise on workforce policy issues and support implementation of all the recommendations here. You know, for a while, and as Donna mentioned, there's a lot of different definitions for community health workers. And so it was important to come to consensus on the definition that the state of Louisiana would recognize. And the definition that Donna gave at the beginning of this presentation is the APHA. Also, she also reviewed the CHW Core Consensus Project, the guidelines for the skills and roles of CHWs. And the, again, I was just going through this last slide about the recommendations from the Workforce Study Committee. And really, I'm happy to say, I'm proud to say that this group continues to meet, as I said earlier, and we continue to move forward with these recommendations from the committee. If anyone is ever interested in joining, please feel free to reach out to me or Donna or Catherine that's here, and we will forward your information on to Meredith Sugarman at LSU, who helps to coordinate those meetings. But remember, bring a CHW with you if you aren't already one. All right, now I'm going to talk a little bit about the Community Healthways program. So in May 2019, the Office of Public Health launched Community Healthways, and the goal of this program is to improve quality of life for Louisiana residents by helping address individuals' health-related social needs and the community factors that drive these needs. It started in the St. Andrew Parish Health Unit, and our goal was to expand this back in April of 2020, but COVID, the pandemic hit us, and so we had to hit pause. But I can happily say that we are now in the process of preparing to launch this statewide. This program really was launched to support systematic screening for health and social needs, provide individual navigation to services to help address those unmet needs, and to convene or join an existing convening or coalition, but of community level public and private sector leaders to address structural factors, fostering health through data-driven investments and new partnerships and businesses. So really, this next slide shows you, okay, so what's the problem that this is trying to address? And it's this unaddressed social determinants of health that really precipitate poor health outcomes among residents in the state. And so our solution at the Office of Public Health is to have community health workers screen and navigate parish health unit patients to community resources to address social needs. So community health workers, they will be working within the parish health units across the state, but also potentially out in the community and partnering with community-based organizations, different types of health centers. It could be a rural health center, FQHC, or other providers in the communities. And the impact, what we really hope to see happen for this project is ultimately, you know, we believe that it will show, and research shows that it should have cost savings to the health system. As I mentioned earlier, I mean, again, going back to the triple aim here, reduced emergency department visits, reduced hospital readmissions, and increasing patient self-efficacy. So here's just a flow chart how that happens. You know, individuals have related social needs, they're screened, and then and referred within a health unit or by community-based organization or provider, the community health workers, and help them identify their needs, identify goals, help link them to different social services, community organizations that can help them get those needs met. And then at the same time, we use the data that this program collects, you know, just aggregate data from individuals to bring it back and share it with the local community and say, you know, we're seeing a lot of folks in this community that have work opportunities, but they don't have childcare opportunities. So we need to work together to figure out how to meet that need for childcare in the community. It could be transportation, it could be any of the health-related social needs. And so now I am going to turn this back over to Donna, and she's going to talk about how she and a team of CHWs have responded to the COVID-19 pandemic.
Okay, thank you, Colleen. So CHWs overwhelmingly responded by delivering the following resources directly to those affected by COVID-19. So I just want to go back a little bit. When we first started this about 8 months ago, we really were in the thick of things with Volunteers of America. We partnered with them. And so we would definitely get cases where we needed food, medication pickup, they needed PPE, and difficult to access cleaning supplies. And where we stand right now, the response as far as PPE and cleaning supplies, well, cleaning supplies still are a high demand item, but PPE has kind of dwindled down, as well as medication and food pickup. But some regions are still making these deliveries. So CHWs were trained to conduct COVID-19 contact tracing, in which they help to interview people with confirmed cases of COVID-19 by phone to identify their contacts and reach out with information on how to prevent COVID-19 transmission, as well as where to access testing. Again, this is something we were doing very early on, and it was very successful. We were able to log, we was able to, see who had contact with who, and that gave us a better idea of any type of outbreaks. And lastly, we've been doing we've been screening the communities with promotion of COVID-19 testing, and more lately, we've been doing the vaccination sites, mainly in rural and vulnerable populations. So again, that goes back to that model of health education, where we're just going full circle and getting everything done in that model. Next slide, please. So no matter thank you. No matter the role, the goal is the same. CHWs have a core characteristic, their proximity to the communities they serve. We are in the communities we live in. We know about the community, so that is a big plus to being a CHW. They are stakeholders invested in building relationships, reducing mortality rates, and improving the community by using boots on the ground mentality to reach the community. We do not have a problem going out, like right now we're working with the Bring Back Louisiana campaign. We are putting hangers on people's doors. We're going out into the communities. Since they won't come to us, we will go to them. Next slide, please. So final thoughts. CHWs enhance public health and communicate trust within their communities. As a CHW myself, I would state that it is an honor to advocate for those who may not know where to begin on their own. Thank you, everyone.
We will now open up the floor for questions. Please type your questions in the Q&A box. Okay, there are no questions. So we can move on to the next slide, please. Please take note of the contact information provided on the screen. Feel free to contact any of the speakers or Well Ahead directly with any questions you may have pertaining to the information from today's webinar. Thank you all for joining us. Visit our website to find out more information about our programs and resources. Also, look out for the bi-weekly newsletter with updates on trainings, resources, and other opportunities. Thank you all again for joining us today and helping us moving Louisiana's health forward.